Hello, today is 2 weeks since my Ahmed Valve surgery, and here's the eye. You can see it's still pretty swollen and red, and I'm still just laying low and not wearing makeup and not going out except to go back to the eye doctor. I'm going to put on my sunglasses because my eyes are very, very light sensitive. I had to go back 4 days after surgery because on 1 day after surgery, my pressure had gone very low. And so he had me come back after the weekend, early Monday morning, and the pressure was even lower. And the anterior portion of my eye had flattened out. So they took a cannula and injected some viscoelastic gel into my eye to bring the pressure back up. That was pretty painful when they did that. It was only for a couple of minutes, but it was pretty painful because they just inject the cannula right into the eyeball and push the viscoelastic gel into the eye. It was actually pretty painful for about 15 hours after that before it became more bearable. And I have my next post-op appointment tomorrow. I see my uveitis specialist on the 13th of August, and I'm sure we'll be discussing the intravitreal steroid device that's coming next. My vision 2 weeks out is still blurry, although I can see the subtitles on the television without any glasses or anything. It's hard to read it, but I can read it. What I'm noticing right now is the eye it's not really painful anymore. It's uncomfortable. And it just feels weird. It feels just kind of scratchy, and it just feels weird. And I guess I'm very aware of my eye all the time because I can just feel, I don't know, it just feels strange, almost like there's a stick in my eye, kind of what it feels like, but it doesn't really hurt. One thing I'm noticing is there's a pretty big difference between the two eyes in the brightness and the color of things. With the new lens, everything's more vibrant and bright. And I'm noticing with blues, I'm actually seeing a completely different shade of blue between the two eyes. So I have my post-op appointment tomorrow, and I will let you know what he says and how that goes.